Good day and welcome to Her Corner Office. I'm Tom Koch, a senior partner and founding member of Kingsley Gate Partners. Let me now introduce our guest today, Kristin Myers Peng. Hello and welcome, Kristin.
Hi, Tom.
Great to see you. So Kristin and I met when she was COO of Unified Women's Health and president of their managed services business unit. Unified is the high-growth company and market-leading platform for women's health services. They provide comprehensive practice management services to over 2,500 physicians and their teams across almost 40% of the U.S. As I usually do, I did a bit of background research on Kristin when I began working with her and Unified, and her background was and is impressive. She has a Harvard MBA, and a BS in bioengineering and biomedical engineering from the University of Wisconsin. So she's a Badger and she's smart. She began her career in med device, then spent 5 years in venture capital firms. Aetna recruited her away from venture capital, and over the years there, she played several key roles, including president of student health and president of the Great Lakes region. As I mentioned, I met Kristin at Unified a few years ago and worked with her on a number of engagements. And the end of last summer, she left Unified and is now CEO of Hopscotch Health. Hopscotch is a growing healthcare services company that's on a mission to transform healthcare in rural communities. Kristin will share a bit more about Hopscotch in a moment. So there were several things that I learned about Kristin that play into why I think she's a leader that folks are going to want to hear from. First, she's very intelligent and open to other people's points of view. She's willing to leverage experts. She didn't always have to be the one that had personally the best answer. And these are traits that are characteristic of some of the best leaders in the world. She's reflective and has learned from her life and business experiences, and she's got a lot to share. She's a leader who has a very high bar for expectation of herself and others, and she elevates people's contribution through her leadership. No surprise then, she's highly driven, but she also maintains a sense of humor and humility. Finally, when Kristin says something is about to happen or is going to happen, she makes sure it does. With that, I'll stop talking about Kristin and we'll see what she has to say. Again, welcome, Kristin. Great to have you today. So let's set the stage. You're welcome. Let's set the stage. Tell us your story.
Wow. Well, thank you for the introduction and thank you for having me. These types of conversations are among my favorite to have just because there's so much we do in our lives and then so much you want to share and things we wished, that we knew 10 or 20 years sort of prior. So my story, I grew up in Wisconsin, which you can hear in my voice if I talk for any duration of time. I, like many of us, like pretty humble beginnings, was one of 4 kids, the third in sort of order. My mom was a nurse. She worked in the psych ward overnight in the VA hospital so she could be home to help take care of kids. So amazing person and sort of model. My dad was a line worker, so like very traditional kind of blue collar worker, was actually laid off in the late 80s, early 90s when automation and sort of computers started to take over, and unfortunately took the wrong path, after that happened. And so it ended up resulting in a pretty difficult upbringing, for my siblings, myself. And while there's challenges that all of us, overcome in life, I would say the independence, and self-sufficiency that you earn or you learn very quickly in that situation, the work ethic, and a lot of who I am today came from that. And so I'll be, eternally grateful for that. Like many, teenage kids that sort of grow up with pretty humble backgrounds, I have the stories of like the 5 jobs that I had. I swam competitively growing up, and my like walk uphill both ways story is that I woke up early in the morning to go to swim practice at 7 o'clock in the morning. I rode my bike 5 miles to go there. I went and worked at a salon, like sweeping floors and washing mugs, back to swim practice, and then biked the other direction to go to Dairy Queen. And I will say that I think I gave the best blizzards of anyone in Mequon, Wisconsin. They were always sort of like run us over. But then like took all that stuff forward, went to University of Wisconsin, as you mentioned, studied biomedical engineering, which then was like a really up and coming thing to merge like medicine and engineering together. And it really set the stage, like probably for solving problems more than it did like to take apart toasters, just to like figure out complex systems and complex problems. And so set the stage for me to dive into healthcare, because that is what healthcare is, a very complex sort of large operation. And then, as you said, spent time in the med device sector, went to business school, landed in venture capital out in California, and then spent almost 10 years with Aetna on the insurance side, which is now part of CVS, and then the last few years on the provider side. So feel like I've just been really lucky to have experience across a bunch of different sectors, and like you have to understand each if you're gonna advance, any sort of innovative solution in healthcare, I think.
Got it. Well, you know what? If you can sell blizzards in Wisconsin, there's got to be something special about that. So kind of related to that, what do you think has been your recipe for success, and what have been your drivers?
Yeah, great question. I mean, I mentioned a couple, in my first comment. Like, I think there's this element of just work ethic and discipline, and sort of like, frankly, doing the work that everyone won't do, and doesn't sort of think is necessary, or might be sort of below them. But I would say like that probably builds up to this concept that folks may have read about around a growth mindset. So the concept of the growth mindset, is really that like brains and sort of talent are really just the starting point, but through work ethic, through discipline, through just staying focused on something and staying at it, like we can all close those gaps and sort of get there. And so this like element of continuous improvement, and like always setting a bar for excellence, and then just feeling like we can constantly reset that bar and cross that chasm, is certainly like one thing. I think there's probably a little bit of tenacity, in it, where like some of us, when someone says something can't be done, you're like, there's like people that lean in further, and then there's people that sort of like lean back. I think diversity of experience, like I think having experience working in different geographies, in different sectors, and just like having to make moves that may seem scary personally or professionally, you learn, what you're sort of capable of as an individual. And then I guess like the last, and maybe I've been lucky with this because I've had a career in healthcare, but I just feel like purpose and intention, go a real long way. So for me, when I have one of those long days, or I just feel like, oh man, like I have too much to do than time to do it, what's at the end of it, and you do it sort of with intention and purpose. So that's probably a short list.
Oh, that's great. Thank you. Thank you. Along the way, did you have mentors or role models that you worked to fashion yourself after?
Yeah, I've been really lucky in this regard. I mean, there's a bunch of different places that I could cite, but there's probably like a couple that are worth noting. Like one, I mean, the time that I spent with Aetna was really career changing. I'd say for a couple of reasons. Like one, it was the first place that I got P&L experience, and like really had this opportunity to come into this like very complex world. And to the point of your opening comments, like had to rely on people that were so deeply, smart in areas that I was never probably going to have the same amount of depth in, and it wouldn't make sense for the business to. And so I had to rely on those. But I would say Karen Lynch, who's now the CEO of CVS, one of the largest companies out there, was such a platform to make an impact. I mean, Karen came into Aetna like not long before I did, and was the person that with, my first job with Aetna was as the chief of staff to the then CEO, Mark Berlini. Like incredible, strategic thinker and sort of visionary in the space that took the company to one place. And Karen, then took over once CVS acquired Aetna. Karen was the first person that took a shot, on me at Aetna to give me a job when there were probably as many reasons to hire me and think that I'd be able to nail it as reasons that you could be like, wow, she hasn't done this before, and is she going to be able to sort of close those gaps? And so those people that take that chance on you in your career are the people that like you want to be able to look back and say, wow, that was one of the best decisions that I ever made. So I think for that reason, I'll always be grateful. But it's also that, Karen and a number of other women that I worked for and worked with at Aetna just set the bar and set the model where, for me, I never thought, whether it's on the basis of gender or anything else, I never thought that it was going to be a limiting factor, for me to make the impact that I thought I was going to be able to make. Mm-hmm. And I think that had a big impact. And then the last, just more from an influencer perspective, if anybody hasn't had a chance to listen to podcasts with Sarah Blakely or sort of follow her on, LinkedIn or social media, I just find her really inspiring. One, she founded Spanx and did so, coming from very humble background and humble beginning and leverages that humility, when she talks about the business and what she's built and continues to have it, despite the fact that Spanx is incredibly successful today. I think one of the most impactful things about Sarah is, I think it was on a podcast where she was being interviewed, she said, I want women to sort of look at me and say, why couldn't that be me? Why couldn't I have the exact same experience? And I just find that inspiring because it can be so easy to make it look like your life or what you've done is so inaccessible. And I actually think like people in the past maybe were rewarded for that to make it look so coveted, right, to have a piece of knowledge or have experience. And I think she has led and built this company and built this incredible thing, but maintained that humility and that accessibility, which I just find really cool.
That is, I love that statement too, and it just speaks to an others-oriented perspective, which is really important for great leadership. So we talked a little bit about your mentors. How important do you think it is to have a mentor to grow as a leader? And what steps can our listeners take to find a mentor or to seek out professional advice and input?
Yeah. None of us can do this in a silo or sort of a vacuum. So I think it totally makes sense. I guess there's like two parts to my response. The first is, I think it's really important to have an inner circle and concentric rings of people that are going to support you. And I definitely think that mentors provide really good support. I would say in a more traditional definition of a mentor, if it's a monthly or a quarterly meeting, the one thing that I feel like I've seen for myself and for others is that those folks that sort of see you once a month or see you once a quarter sometimes are not in a position to like give us the like really tactical kind of coaching and sort of feedback to kind of see like how we are in different settings and different moments. And so I think it makes a ton of sense to think about like those folks, whether it's people that are 2 or 3 ticks, ahead or above of where we are in career, to seek coaching. But in my experience, I've found those relationships, Tom, to be really valuable when there's like a specific skill that I'm trying to develop or a specific decision that I'm trying to make or something like that. And then to also in parallel tap into that circle of people who are around you, every day. I've joked that my husband probably could give you like the same list of strengths and weaknesses or strengths and gaps to close or watch outs as someone that I'm working, directly with. And so I think really tapping into that circle is really important. So both of those things, both the mentors, but also those people that like are around you all the time and sort of really know you.
Got it. Great. Thank you. Okay. So I mentioned in the intro that you are CEO of Hopscotch Health. What compelled you to make this leap especially to leave a number 2 spot or the number 2 spot at one of the largest women's healthcare organizations in the country and go to a much earlier stage company?
Yeah, it's a great question. And I mean, it was absolutely this sort of like moment where a bunch of different things, candidly from like different points in my career, all came together to this sort of compelling opportunity. Let me first answer like the Hopscotch sort of opportunity and maybe set the stage by actually sort of painting the vision and mission of what we're trying to do. And then I think it'll actually become pretty clear why I was so excited to kind of come and build this. So Hopscotch Health is really focused on rural communities and specifically primary care in rural communities, knowing that like that is really the home, the patient-centered medical home of where patients start. And often, and in most cases in rural communities, there's a very high percentage of Medicare and Medicaid patients, so very high acuity, high need patients, and less in the way of resources, whether it's things like transportation or sort of behavioral health. Certainly a shortage of specialists, but even in many cases, a shortage of primary care physicians. And paired with that, I think really difficult circumstances for some of the primary care physicians who are operating in these community-based practices. Rarely do they even have a full-time team member, not in a position to offer benefits and working, sometimes upwards of 11, 12, 13 hours a day and taking a few days off a year to serve their communities and their patients, and by the way, doing a great job at doing it. And so Hopscotch is really looking to leverage a lot of innovation that's happened over the last 10 years, especially in sort of these next generation primary care models, things that we know work for patients, work for providers, and are driving really good clinical outcomes, whether it's team-based care, sort of wrapping additional resources around these patients so that they're getting the care that they need it when they're outside of the clinic. So we're looking to take those things that are proven, pair them with what we know about these communities and the needs of these communities, and really leverage the strength that already exists there to deliver this great primary care, which is really focused on understanding the needs of every single patient and then wrapping a lot of resources around the needs of those patients. And then I guess lastly, partnering with payers and the insurance companies, which is really important because you have to align incentives across the board. And you do good, by doing good for all of those stakeholders. Really partnering with insurance companies to say, okay, if we deliver those great outcomes and we do everything in the right way from a clinical and a quality perspective, we need a partnership where we're actually getting the reward for that. We're happy to take some risk for it as well. But doing it. And so that, to go back to your question, when I got tapped to sort of consider taking the role with Hopscotch, it was really sort of this culmination of like being able to tap into different aspects and skill sets and experiences in my career, and really test myself, in a different way, frankly, in a different setting. I think the opportunity to build a company after having, run something at scale, and to think about the business and whether it's the systems, the processes, but most importantly, the people and the culture, and think about like using first principles to really understand these communities and the needs of those communities, and then build a business and make sure there's a model that's effective and sustainable, was really interesting. And then I finally being able to build a team and work with a group of investors and a board, who were largely individuals that I knew, before jumping in. And so it's just the trust and sort of the relationship aspect of what you're able to do and what we're able to do as people when we're working with someone that we know and trust already is just really fantastic. And so it's been probably almost 10 months since I've been with Hopscotch, and it's been fantastic.
Oh, that's awesome. And it is, what you described is such a complex set of challenges with payers and availability of providers and the like. I mean, this is important work, and it's exciting to hear that it's going well. So clearly, a part of leading to success or growing that organization to be successful has to do with leadership. Can you take a step back and talk a bit about your leadership style and also maybe how you think about building culture?
Yeah, two great questions. So one, my leadership style, I think it's a lot like me. I think it sort of has this like dichotomy that can be a little hard for people to sort of digest when they first meet me, but that I think are probably what people come to love, over time. And certainly once they understand it and the intention, like those two aspects are, on one hand, there's this driven, really like, let's get this right. It is so important, and let's do it with purpose and intention, and sort of raise the bar for ourselves and others as far as excellence, and like really make sure that we're showing up with our best selves. But then we're also like pulling that out in those that are around us, and like, just being really cognizant of it. I think the second piece is this like really caring, trust-based, element, which is I think that we all are at our best, when we're in a situation where there's like really clear trust in a competence standpoint, where we're trusted to do our jobs and operate with autonomy, but also like trusted and cared for in that like there's high integrity and that folks have your back and are assuming positive intent. And so when I think about culture, I've probably spent more time in the last 9 months than in my entire career, thinking about culture. That's the thing when you're building a company, and you're being really cognizant that people are taking a total chance. There's like really talented people that are jumping on this boat who have no less than 11 other opportunities that they could go after, but they're choosing to be here. And so when I think about building a culture, I think there's probably three aspects to it. Like one is values, the values of the organization, and being really thoughtful and smart about them. I think two is like expectations, just being really clear about like the definition of someone's role and what the objectives are and the goals and what success looks like and the support that they need to do that. And I think the last is team norms. And, I've thought a lot about this, especially because at Hopscotch, our pace is fast, the intensity is high. Like, I think the juice is worth the squeeze. It makes me sound a little bit like a consultant to say that, but I think it's there. But you have to be sure that like you're going to get what you want on the other side, but it also may not be, a place for everybody to sort of be in a startup and be dedicating, that amount of time and sort of work towards something. And so I think it's an element of putting a stake in the ground and being really clear about who we are and who we're not as an organization. And actually right before you and I got on this call, we have a monthly team check-in. We send out a pulse survey, and we have a chance to just come together and sort of see like what's working and what's not, and what are like the quick hits on things that we could do differently tomorrow versus the long-term things that we need to work towards. Because especially in an organization like Hopscotch, whatever strategies and tactics we had 2 months ago are probably not going to work, at least half of them, 2 months from now. So just staying really, really cognizant about that too.
Interesting. And you're right. The cycle time for you is short to the next set of changes. We talked almost exclusively about the work setting. Maybe we'll expand a little bit. I understand your husband's in healthcare as a physician leader in Chicago, and you have 3 young boys together. So there are a lot of men and women trying to strike this balance between work and personal life. What have you learned about doing that successfully, and what's some advice that you might have?
Well, my first piece of advice is if anybody needs to feel humble, they should have children, and like multiple ones at that. You are right, Tom. We have 3 little boys, one that just turned 3, one that's almost 5, and one that is almost 7. I think, my husband and I are just incredibly lucky. We met later in life. We both have careers that are really important to us. Dave is a physician, as you referenced. And so I think maybe second behind the humility is really just knowing what's important and really prioritizing that. And so for us, like we knew, that there were going to be things that probably needed to fall off the list. If I'm going to join Hopscotch and build this company, and we have 3 little boys, there's just trade-offs, that we make. Certainly from an investment perspective, I mentioned my family background. Dave is an only child, so we don't have family close. And so we invest a ton of time and energy into making sure that we have really good caretakers. And we've been very lucky from that perspective. But I feel like that's probably a whole separate blog, podcast, or something else to just talk about how you make the logistics, work. But I would say starting with what is most important, and then realistically sort of planning it out and knowing, your limits. It's funny, I'm, talkative and obviously in a position where, like you, I'm, externally facing a majority of the day. I'm actually quite introverted. And so when I get to the night and the weekend, in most cases, my preference is to be with my family, and not necessarily run around. Like, we don't do generally the whole like Saturday morning soccer games and things like that, partially because we really value just the ability to go from place to place as a family when your whole week is so structured. And so that's a perfect example of where if we were following sort of the check, the check boxes on like what a suburban family should be doing outside of Chicago, there's probably a lot of things that somebody would think that we're doing. I guess the other, funny thing that hopefully will make some people laugh and maybe feel better. I don't actually think I've cooked a full meal for my family in probably 5 years. And to be clear, I would be fine eating, a bowl of cereal for dinner. That's not what my kids eat. My husband has finer taste than I do, but it's also like that's a perfect example too, where it's just not the norm. But it works for us, and so I think there's a level of, you just have to know your limits and sort of not, to a certain degree, kind of throw the paper out the window on like what expectations others might have of you, and just know that, we each have to look at ourselves in the mirror, before we go to bed at night and feel good about the life that we have and the choices that we're making. And so for everyone, it's just going to be different, and it might be different over time. I know you and your wife have navigated this, in your lives as well. Like, it changes when your kids are the age of my kids. It was different 5 years ago, and it's probably going to be different 5 years from now.
Definitely. All right. We're getting close to the end here. We talked about your leadership style. Can you share some thoughts on how women can develop their leadership skills, and maybe what are some things to avoid that can become derailers?
Yeah, there's probably 3 comments on this. Like, one, I do feel like, and you probably hear this kind of throughout a couple of my answers in our time today, but there's this sort of element of like knowing our baseline, like, know what your strengths, are, and know, what they're not. And I think we can all work to close gaps and sort of remain really self-aware, which is probably the second thing I'm going to cite. But there's this element of just like, let's be clear about the foundational pillars, because I would not say those have changed, for me over the course of the last 20 years. I think there's things that emerge over time. But I think knowing your baseline, I think there's an element of self-awareness and coachability. I actually feel like, I'm not sure what the right line to draw as far as a point in time, but certainly when you're approaching a role where your next step might be a general manager role, interestingly, it's no longer probably subject matter expertise, that's going to sort of drive. It's not going to be that you worked 11 hours that day instead of 9. I mean, certainly getting your work done and driving results is really important. It's going to be, more about like having a self-aware and proving that you're coachable. Like, it is probably one of the number one things that when we're interviewing for a senior role in any of the organizations that I've been a part of, and it's time to do reference checks. You remember when you and I were working together, I do every reference check, for an important senior hire, really any hire at Hopscotch as well. Having those conversations is really important, and sort of understanding the level of self-awareness and then coachability that someone has, because going all the way back to the growth mindset, no one, the expectation is not that anyone's perfect, including me. It's that we sort of course correct and self-calibrate over time. And then there's sort of like two thought-provoking things that I guess I'd sort of put out there, especially if like folks really like to like look up a podcast or read something. One is there's a book that was co-authored actually, but one of the writers is Marshall Goldsmith, who did What Got You Here Won't Get You There, which is a pretty well-known leadership book. And the book is called How Women Rise. And one of the interesting things that the book talks about is that there's 12 habits that keep women from reaching their goals. And so generally I'm a fan of like looking at the positive and sort of leveraging the strengths, but it's pretty interesting because Marshall, at least in the preface of the book, he talks about, a large percentage of the folks that he's done leadership coaching for and with over the course of his career were men. And so there's just different attributes and qualities, that women versus men have. And so interestingly, one of the 12 is overvaluing expertise, which women, sort of do. I think another is around managing your job versus your career. Women are really good generally at keeping their head down and sort of like delivering on things. And then I think a third is, expecting others to sort of recognize, the things that you're doing instead of actually citing that you were a main contributor, to really positive results. And so I think it's thoughtful to sort of throw out there. I'd be surprised if everyone didn't read it or listen to a podcast and think, oh, wow, there's at least 2 or 3 things that are there. And then the other, which is like, this one is more about like situational awareness and sort of going back to like the world around us, and recognizing that not everyone is coming at things from the same place. When I was in Silicon Valley right after business school, Sheryl Sandberg, had really started on her rounds of giving talks around women in leadership, which ultimately is what led to the Lean In book. But one of the things that she referenced is a Howard Heidi study. And so if anyone does a Google for Sheryl Sandberg and the Howard Heidi study, they'll hear it. But it was a case that was written about a real person named Heidi. And Heidi was an entrepreneur that turned into a venture capitalist. And the case really just describes like her doing a deal and sort of normal things at work and the way that she works with people, the results she delivers, and the way that she collaborates. And the interesting thing is the exact same case, the exact same text was taught to 2 different classes in business school. Mm-hmm. In one case, she was Heidi, she was a woman, and another, she was Howard, she was a man. So exact same text. And so in both cases, the feedback from the class was that she was very capable. Like she was very, she was someone who was able to deliver results. But when she was Heidi, they were very skeptical. They weren't sure if they wanted to work with her. They weren't sure they could trust her. They weren't sure that she is someone that they would want on their team and really to rely on. Versus Howard, they loved, thought he was real confident, capable, like want him on the team, probably want him to lead. I would guess, I'm not sure if the study went there. And so it's really interesting. I think that there's just a situational awareness that we have to have, that these things, like go back to me mentioning dinner, there's probably faces that like mouths that dropped when I said that, but it's the truth because there's just expectations. And so all we can do is be aware, of those things and recognize them. I don't think we can change, some of the things that we'd like to change overnight in the world, But it is cognizant, especially for women who aspire to be leaders and who are already leading, to be aware that the same exact like actions and circumstances may result in different sentiments and conclusions.
Really interesting. And actually, those are great resources. So let me just repeat it. The first you referenced was a book called How Women Rise by Sally Helgeson and Marshall Goldsmith. And then the second is the Howard Heidi study. So just wanted to mention those again, because I think those are great resources. Yeah. All right, one last question. If you were a mentor and giving your younger self career coaching, what one suggestion or insight would you provide to the younger you?
Oh gosh, Tom, you know I always cheat, so I'm going to have more than one, but I do have a couple. Like one is, if it's something you want, just go get it. Like I think, you know, sometimes we get so caught up in like thinking that there has to be this like grand plan and like one thing has to lead to another. You know, I think oftentimes people look at my career and think like it was this totally planned out thing that I was going to spend 5 years in this place and then 3 years in this place and then go here. The reality is, you know, I just made the best decisions that I could with the information that I had. And so I think there's this element of like, kind of just keep swimming and moving forward, and do so with intention and sort of with a plan. The second, and this is probably, you know, one other takeaway, really, really good and thoughtful article that I read, I think last year. I think it's an HBR article called Success That Lasts. And, you know, at the end of the day, we each may define success totally differently. I think in this case, there were 4 dimensions. So happiness, achievement, significance, and then legacy. So I won't sort of give a ton of detail because then maybe folks can just Google it or listen to the podcast, but kind of depends like what you're looking to achieve and like where you derive the most energy and impact from. And so I think some of this is like you have to know what you're going after in order to make the right decisions, you know, for what you're doing. And sometimes it's often actually when we find ourselves in situations that we know it, like the situation is not ideal and we know we want something to change, we're actually not sure what the underlying driver is. That may have actually been the circumstance in which I found that article, or at least found the most relevance, which is, I think I was talking to a friend and, you know, she was working through something that was quite complex actually with her career and trade-offs and personal decisions, you know, versus professional ones. And by all accords, she was like wildly successful, you know, in this place, but I actually think that she was really yearning for, you know, a different dimension to be filled. And so sometimes I think that can be really helpful, you know, almost something to pull out at the right time or every few years or something like that to really think about where we're headed and like what might be different, you know, from now versus 3 years ago when we thought about it.
Fantastic. I mean, really good advice and resources, both to your younger self and to others. So this has been fantastic. I've really enjoyed it, and I'm sure our viewers and listeners will as well. So with that, let's sign off and hope you and others have a terrific rest of the summer and look forward to seeing you again soon. Take care.
Wonderful. Thanks, Tom. Thanks.
Yeah, thank you.
Bye.
Bye. Bye-bye.